Hi, my name is Dr. Shannon Shea. I have a PhD in applied behavior analysis and a master's of science in counseling. And I wanted to tell you a little bit about who I am and what behavior therapy is. So to start, behavior analysis is the science of how all humans and really animals learn and how your behavior is shaped and changes in response to your environment. A lot of people have heard of applied behavior analysis as therapy for autism. And although it is used for that and it's effective, it's been successfully used to treat a number of things long before we discovered that it was effective for treating autism. And it's an entire science. It would be like saying that physics is the science of using GPS. Like, it was applied to that, and we got GPS to work because we understand physics, but it's not like a GPS technology. The same way that behavior analysis is not an autism technology. So essentially, what the difference is between doing behavior therapy and then maybe mental health counseling, where you're talking to someone, is that behavior therapy is going to be a little bit more action oriented, and we're going to rely on data. So essentially, when we start, we'll look at what your behaviors of concern are, the ones that you want to change that are causing you problems. If they're associated with a diagnosis or not, doesn't make a big difference to me. If you are diagnosed with something and that diagnosis is important to you, helps you find support in the community, that's just fine. But as far as my purposes go, the diagnosis isn't essential, and I don't diagnose people with anything. So we start with the behaviors that are causing you problems. So say, for example, you have issues with anxiety, and it's preventing you from getting out there and interviewing for new jobs or finding a girlfriend, boyfriend, partner, whatever. We'll look at the behaviors associated with that. So it might be your heart races and it prevents you from initiating contacts with new people, right? So we'll look at that exact behavior, what happens before, what happens after, what in the environment is prompting it or making it better or worse, that kind of thing. And then we will also do an analysis until I have an idea of what the cause of the behavior is, or the function. And then we will make modifications to your environment and teach new behaviors so that you can behave differently in the future. So that's what I mean by more action-oriented. We're not going to talk at great length about like your childhood or your past or a dream that you had or things like that. It'll more be like, exactly what are you doing? What does it look like? How does it work out? And what would you like to happen? Whereas in therapy, it's more, usually you discuss your problems, and the thinking in counseling, because I did go to school for that, is that if you change your thoughts, and that would change your feelings, like if you change how you think about things, then your feelings will change. So that could reduce your anxiety or whatever. And then your behavior will change as a result of that. What I do, behavior therapy or behavior analysis, is the opposite, right? So if I change your behavior and I change your environment, or you do, then, your thoughts and your feelings, all your internal stuff will improve as a result of that. The other big difference is that we take data on whatever behaviors we're targeting for change, and we evaluate the data continuously. And if our plan isn't working, you're not seeing the changes that you'd hope for, the data isn't showing that the treatment's effective, then we try something else. We follow the data. It's not bad. It's just more information. So that's the big difference between behavior therapy and kind of like counseling talk therapy. Is behavior therapy tends to be more action-oriented. There are concrete goals that we're trying to reach. We're collecting and reviewing data, and it's more about practicing and getting out and doing stuff than discussing although we will talk about things so that I have an idea of what you need and how things are going and how the behaviors might have developed. So that's part one. As far as life coaching goes, it's very similar. It's just generally different goals. Behavior therapy tends to be more intensive, usually associated with a mental health diagnosis, but not necessarily. Life coaching, we still collect data, we make concrete goals, we evaluate progress, but that would be to establish habits like starting a diet, exercise regimen, things like that. Studying, going to school, going to sleep and waking up at the same time, those sorts of things. And the goals of life coaching are similar, but it's generally starting new habits or getting rid of habits that you don't want, like quitting smoking or eating ice cream when you're upset. So there's not a huge difference between the two. It's just generally the severity of impact on your life. Generally, behavior therapy is for behaviors that are causing you distress and causing distress to people in your life and preventing you from doing things that are important to you that you would like to do. Whereas life coaching is more, I just want to be healthier. I want to go back to school. I want to learn this habit and I can't quite do it on my own. I need someone to make a plan for me. I need data. I need someone to be accountable to. So that's kind of that idea. And then I will make another separate video on a little bit about me and my background and how I came to start doing what I do. Hope that was helpful.